Welcome doctors. Today, I want to talk to you about something that sits at the heart of every billing, payment and patient data process you deal with: HIPAA compliance in revenue cycle management. Now, I know compliance might not be the most exciting topic, but here's the reality. In the digital age of healthcare, patient data flows through so many hands and systems, from scheduling and insurance verification, to coding, billing, and collections. Every one of those steps involves protected health information, or PHI. And if that information isn't handled properly, it's not just a legal problem, it's a patient trust problem. HIPAA, as you know, has been around since 1996. It's the national standard for protecting patient data, and in revenue cycle management it's not optional, it's foundational. We're talking about three key rules: the privacy rule, which governs how PHI can be used or shared; the security rule, which requires safeguards for electronic PHI, which tells us how and when to notify people if their data has been compromised. Think about your daily RCM workflows. During pre-registration and scheduling, you collect demographics and insurance details. In eligibility checks and prior authorizations, that data is shared with payers and clearinghouses. Clinical documentation and coding add diagnoses, treatments, and procedures. Claims submission and payment posting bring in financial data. Even sending a patient a billing statement means you're handling sensitive health and financial information. Every single touchpoint has to be HIPAA compliant. But here's where the risk comes in. PHI sent over unencrypted email. An employee who forgets to log out of a billing system. A third-party vendor without a business associate agreement. Or simply a staff member who hasn't been trained to recognize a phishing attempt. All it takes is one slip for a violation to occur, and that can mean fines, criminal charges, lawsuits, or losing payer contracts. That's why HIPAA compliance can't just be an IT responsibility or a legal formality. It has to be baked into the entire RCM process. From your front desk team to your coding staff to the vendors you work with, everyone needs to understand the rules and follow them. Secure logins, encrypted communication, role-based access, vendor agreements, audit trails, and clear incident response. Plans are not nice-to-have features, they're the foundation for protecting your patients and your practice. At the end of the day, compliance is about more than avoiding penalties. It's about protecting the trust your patients place in you when they share their most personal information. In an era where healthcare data is more connected than ever, HIPAA is what keeps that trust intact while ensuring your revenue cycle runs smoothly and legally. So, doctors, the takeaway is this: treat HIPAA as an active part of your daily operations, not just a checklist. Because when we protect our patients' privacy, we protect our reputation, our revenue, and the integrity of the care we provide. Thanks for watching.